This pandemic period has resulted in a massive shift and transformation of our perspective regarding the socio-political and economic sectors. But the commercially safest trends have been the rise in masks and sanitizer production and utilization. The science behind masks and sanitizers' role in controlling the infection is neither complex nor simple. Although these are effective methods of self-protection, our inexperience and ignorance is massively affecting its efficiency. We are not going to bore you with the protocol of proper usage of masks, gloves and sanitizers etc. But we can assure you that it's a very long protocol and contains tons of points to ensure proper usage. There are two main objectives of wearing a mask. One is preventing release of nasal and oral contents into the surroundings, which is the general laboratory purpose. And the other one is more of a public purpose, which is to avoid entry of particles from the environment into your nasal and oral cavities. Having said so, is a mask really helpful in preventing the SARS-CoV-2? Well, the answer would be both yes and no. Several experts have already commented that a normal handkerchief or a napkin is effective in blocking this particular viral entry. But at the same time, a few reports have claimed that wearing masks increases irritation around nose and mouth, making it more prone to be touched by your hands. Obviously, you don't need a research paper to validate that. The habit of pulling down mask from nose to chin and pulling it back up nullifies the advantage of wearing a mask in case the air you are breathing is contaminated by the virus. Overusage of a mask is a really bad idea and is a potential health disaster to your lungs, inviting chances of allergies and pneumonia. There is a reason why the normal masks have a limited time period for healthy usage. Overusage of masks infers compromised fabric material integrity, releasing the fabric particles into the nasal cavity with every inhalation, and disrupted pore sizes won't ensure effective filtration of air. The overflow of sanitizers, a commercial consequence of corona. Sanitizer production have achieved an incredible rise since the outbreak. An increase of whopping 400% have been observed in India alone. Around 150 new companies solely based on sanitizer production have come up. The demand has risen so much that around 100 distilleries are compelled to be transformed as sanitizer producing industries. These sanitizers are used by both health officials and the common public as well. Hence, the primary concern here is that ethanol, being the key ingredient of sanitizers, is lacking in supply with accordance to the increasing demand, which might cause a potential shortage for usage by health officials who are in dire requirement for it. Exposing skin to 70% or more alcohol content several times a day cannot simply be considered a healthy care routine of the skin. The alcohol content in sanitizers not only kills the pathogens but also the good ones. It also dissolves certain essential oils which provides natural protection. The real threat. Assessing the situation of this pandemic, we can claim that our governments and health officials have done a commendable job until now. But that's not the real problem here. The real concern should be the mass hysteria regarding this pandemic. The distress in economy, migrant labor crisis and mental and physical health of COVID-19 warriors are just the surface of many disasters we are about to face. Before blaming anyone, we should understand that we are one of the most densely populated countries with an unfair ratio of workers to victims and hospitals to patients. Till now, our government has been handling 80 to 90% of the cases, but as the situation worsens, private sectors will eventually enter the stage. This is a serious concern as the average expenses stand at 20 to 25,000 per day. For the standard 14-day treatment, it multiplies into 2,80,000 to 3,50,000, and that too without using any ventilators. Being a nation with a history of natural calamities like famines and flood-related disasters and emerging out more formidable than before, thanks to our not so easily breakable optimism, but unfortunately this attitude has misled us, doing more damage than good. Our perception regarding the situation, highly influenced by our medias, got so deceptional that we addressed this in the most impractical and delusional way possible. Till now, our COVID warriors have stood tall, but for how long? They are humans too. On a final note, by considering this as a warlike scenario and calling them fighting against it as warriors, a notion was implanted that the general public had a secondary role in this hustle, fueling our instinctive irrelevancy and irresponsibility. Thank you for watching this video. Take care of yourself until we come up with some more minutes of science.